About 46% of women overall experience GI issues. And 70% of women, for example, will experience shift in their GI symptoms during menstrual cycles. Yet, when you go to look for the data to, try to understand why this is happening, there's really a paucity of data out there.
Dr. Asha McCutchen, a very, very warm welcome once again to the Scope Forward show. This time you're in a new avatar. You're the co-founder of OLVI Health, a new startup in women's gut health. I'm so excited to do this interview and I'm really curious what you're up to.
Absolutely. Thank you for having me on here again, Praveen. I think it's been a few years since we last spoke, and we were talking about equity in the GI space at that time. So I'm extremely excited to introduce OLVI, not only to you, who has emphasized exponential technologies in the GI space, but also to the world. So thank you for having me.
Let me start by asking you, what's this startup all about?
I have about 40,000 women patient years of experience. And what we've seen in the GI field in general is a significant demand, not only for GIs, but for women GI because of the uniqueness that women have. And so we have been tasked as women with having increased administrative burden. We've got long wait times on average of about 6 months, and trying to navigate the complexities of not only the time constraints, but the mental demands of being a woman in GI has been challenging and rewarding at the same time. So over the past couple of years, you've probably seen the formation of various committees, various summits, various groups that are addressing the unique needs of women in GI serving predominantly female patients. And so along that journey, I was able to connect with two other women that were extremely passionate about females in GI and particularly addressing the unmet needs of women that have digestive issues. And that's where I met my co-founders. Actually, it was at the American Gastro Association Women in GI regional conferences that we officially came together. And that was Dr. Asma Khapra and Dr. Latha Alaparthi. And Dr. Alaparthi is very special. She was the first woman president for DHPA, which is a lobbying and advocacy organization. Dr. Khapra initiated for a very large PE-backed platform, a women's health network, and I have served as first woman on the board of directors for my platform company as well, which is the third largest platform in the United States. So collectively, we had the passion, the enthusiasm to not just make a local impact, but really to really be a part of something bigger. And I think that was a goal that we all shared.
Awesome. And congratulations to all three of you and the rest of the team that's to follow. So I want to ask you, what are these women's issues? I'm asking a basic question. Why are women's GI issues different? And who specifically are you targeting, or what kind of patients?
Certainly, the literature and the data shows us that women experience functional GI symptoms such as irritable bowel syndrome at a disproportionately higher rate than our male counterpart. There are other GI diseases such as autoimmune hepatitis, for example, gallstone disease, pelvic floor issues that disproportionately affect women. And when we went to sort of dive further into what the challenges were, we were just appalled by the lack of data in this particular space. Why are these changes occurring? Is it because the woman shares the, compartment, for example, the same compartment, reproductive organs? And we found that if you look at the data, about 46% of women overall experience GI issues. And 70% of women, for example, will experience shift in their GI symptoms during menstrual cycles. Yet when you go to look for the data to, try to understand why this is happening, there's really a paucity of data out there. So we started on this journey to enter into the fintech space because we were seeing emerging initiatives, particularly like out of Johns Hopkins, to address women and why they had different presentations for their cardiac disease. But we didn't see a lot in the GI space whatsoever. Then when we looked at digital health applications, which when we were just doing, intense social listening with our women, we found that about 60% of them were using like menstrual cycle apps such as the Flow app, and saw a huge opportunity. There's just this big vacuum, this big void where the GI symptoms that are disproportionately affecting our women on a day-to-day basis and going undiagnosed could potentially be met by technological advances.
Awesome. I took a look at your website. Now I see also educational information services and also a store where people can buy things. So what exactly are we going to sell? Is it selling already? And what are these solutions?
So this is a great question, Praveen. I think that all of us that are practicing in GI have seen the effects of misinformation being spread by way of social media and other omni channels where patients receive their information. And so part of our goal with OLVI is to drive people away from anecdotal evidence and move them into more evidence-based solutions. So within our store, everything that we offer will be an evidence-based validated solution based on rigorous scientific data. We don't want to just come on here and sell supplements. We know that selling supplements, can be wrought with, issues that's dangerous, right? Because anybody can bottle up a supplement. So we really wanted to be able to, based on what a person was experiencing, be able to provide them with something that was from a reliable source, but that was scientifically backed. So that is the basic premise of the store.
Now, you've been a two-time participant of the GI Mastermind, and we often talk about exponentials. I'm curious to see how you connected the dots and how is this an exponential model?
Absolutely. So we've all been trying to figure out how to go from serving one-to-one to really serving one-to-many, right? And as we were thinking about how we would build out our technology, we wanted to understand, were people more interested in community? Were they interested in being a part of a cohort? And so what we've created essentially are AI-driven pathways that help people to, by using their own data analytics, to come up with solutions. And they would be able to walk through sequentially the program, and we calculate their gut scores and they can understand really what the contributing factors are. And it's a unique platform because this is going to be the first platform that actually helps women to also understand the connection between their digestive symptoms and their reproductive hormones. So they can understand whether their cycles are contributing. Is this a perimenopausal effect? And so this will be a novel intervention in that way. But it's something that, they're able to go down different pathways using the AI-based algorithms that are created, but still in a personalized manner.
How did you figure out the funding? Is it self-funded? Have you raised money? Can you talk about that?
Sure, every founder needs money. Every startup needs money. So we did initially bootstrap. And I think it's actually great to bootstrap because as physician founders, we consider ourselves like this trio powerhouse of female physician founders that really understand the market and the market forces and what the needs are. But we had to put on a different hat, and it was a business hat, and we had to learn to budget. I mean, we started to create our equity cap tables, which, I'm used to removing polyps. I didn't know a ton about these cap tables and what that meant, but really understanding the fundamentals of business is essential when you're bootstrapping. So I'm very grateful that, we took that approach and didn't just do an early partnership or, receive funding from industry, for example. Not that I'm against it, but I think there's some value in putting your own dollars into what you really believe in and what you're trying to build. Not only that, but it allowed us to maintain a level of control. in not only the product, but the narrative, the story, the brand, and so we've been, kind of very excited about sharing the story behind the brand, and that is a part of the story. So we, for the majority of the early stages of development, we bootstrap the project.
Congratulations. I'm so excited to hear all this. You and the team, you've dispelled many myths that we live in healthcare, in medicine, in GI even. Number one is, that physicians don't do startups, like, because you're all so busy with your private practice world and everybody's head is in the endoscopy room. So where's the time? So you've dispelled that myth that, somehow, despite your leadership roles, despite everything that you do, you still have been able to figure this out. Number one. Number two is also women in GI. And this is another thing that keeps doing the rounds. For men, it's different, but for women, it's altogether different. They don't have time. They've got family responsibilities and everything. Now, you've dispelled that myth too. So I'd
Right.
love to hear more. And if you can talk about this and anything on these lines.
Yeah, so I think it's very interesting whenever you go to pursue something that you're passionate about, you absolutely make the time. And this has come up, over the past couple of months as we are in our pre-seed round, our capital raise is, you have physicians that are still practicing. And as we talk about, Praveen, those closest to the problem, though, are those closest to solving the problem. So it's important for us to maintain those clinical touches so that we can continuously get feedback from the population that we're serving. And I think that is actually a strength in this particular platform. And then we have 3 women that have different practice environments. So one of our co-founders is the CMO of a hospital system and has some flexibility in terms of administrative time and then being able to control the schedule. I have been able to, being in private practice does allow some flexibility in the way that we're scheduling. Now, of course, we are still on an eat what you kill model, but there is some flexibility in terms of me being able to predictably allocate hours towards the project. So what we've done is we've taken what would be probably, a 70-hour work week for potentially a CEO, and we've divided those tasks amongst ourselves. And we learn to organize ourselves as well. We use some of the platforms that are available, such as Monday for task organization. We try different platforms. We try Slack channels and Discord and all of that. And it has been such a steep learning curve, incredibly exciting. And like I said, when there's passion behind it, I think you can stay up all night and do it. I don't think an entrepreneur in the startup phase is even interested in sleep.
So, Aisha, what advice do you have for people who might be watching or listening to you and thinking, how can I be in her shoes?
Well, we always go back to the basic premise, Praveen, as to understanding your why, right? And my why has been that I've had a really rich career in terms of being able to make local impacts and even national impacts. But how can we continue to address the unmet needs of those that we're serving? How can I ensure that everything that we're trying to roll out from an equity standpoint, from an access standpoint, actually is amplified and available to the masses? And so you really, in order to do this, you just need to take the first step. My husband always said, you can't get wet if you don't jump in the pool. So jump in the pool and start working on it. Put the right foot in front of the left foot. And there's so many twists and turns, and just the intellectual stimulation alone of learning, how businesses work, how equity works, how stock options work. I mean, it really sort of empowers you as a physician, but not only that, but when you walk back into your practice, the things that may have been sort of bewildering to you, or, this seems unwieldy that we're making all of these changes, now these things make a lot of sense. It makes sense. You have to have organization within structure. So, I would encourage anybody that is passionate about a particular area or finds an unmet need to go ahead and jump in the pool, get wet, figure it out. And one of the things that I shared with my co-founders the entire time, that one of my mentors that shared with me, for an entrepreneur, you need to break things and break things fast. we are definitely used to taking calculated risks, right? We, as physicians, we're like, well, what's the risk benefit ratio? And our risk tolerance is not that high because we're dealing with human lives. This allows a little bit of flexibility here, right? So we can take some calculated risks, much greater than we're used to when we're dealing with human lives. We still have to be careful about, data privacy and all of these other aspects that go into it, and making sure that our algorithms that we're building are correct. But that's where, bringing in other perspectives, building out great teams happen. And I think when you can create something from scratch that you're passionate about, there is no greater reward that I've experienced, in my career.
For me, it's always exciting to see something tangible form out of conversations or initiatives such as the GI Mastermind. What made the biggest impact for you from that program?
I encourage everyone to join the GI Mastermind. If you are a futurist, this is a group that you should be in. We all kind of, we're in our local environments on a daily basis. And within that environment, you are the core decision maker, quite often. But to really get a broader understanding of what direction the field is taking and what the potential disruptors are, and being able to exchange ideas with other brilliant minds, that was the greatest value. That was the value created by the GI Mastermind group. It really is an intellectually stimulating cohort of individuals that not only talk the talk, but they actually walk the walk. So within that cohort, I was seeing people develop tangible products and services and exponential technologies. And, I would talk about, there will be a colon robot in the future. And Lord behold, the next week, there's a guest that has created the colon bot. And so it's almost like a think tank that you're able to be a part of. And so not only will you have an impact now, but this will shape the future of gastroenterology. So the experience in the GI Mastermind has been invaluable. So I thank you, Praveen, and everybody else that's been a part of that, of shaping that particular program.
Thank you for saying that. I'm curious to know, Aisha, like if you have to reflect on one takeaway for you, like a single one that really stood out and that changed the game for you, what would that be?
I remember you came on and showed a video. It was a video where it was a nursing home. And I believe this was closer to COVID. And we were dealing with a lot of depression, sadness, increased death rates, for example, in not only hospitals, but nursing facilities. And it was flat out due to sadness. And there was an avatar type of robot that you showed on the screen, and they were able to emulate the human expressions and potentially mitigate the emotions, the negative emotions that the nursing home residents were experiencing. And I thought, oh my goodness, if technology is able to sort of not replicate or replace, but assist us in this type of way. And we know that, longevity is linked with, having lower rates of depression and so forth. If we can potentially change lives in this way, then that's incredible. So that one, I don't know why that one hit home for me, but, being able to, use these, artificial intelligence models or robots, I think is just a huge opportunity. And I think it will decrease the workload because at the time, there was a huge shortage of nurses in the hospitals, right? We were robbing Peter to pay Paul, and the cost of employing nurses, we have all these travel nurses, it was extremely high. So I can imagine, what the GPD on the healthcare cost was at that time. But this was a positive intervention that could improve lives. And so from there, my brain just continued to go on about the infinite possibilities based on current technology and future technology.
How interesting. And that is exponential thinking. And this is like a live demonstration of that. How exciting. My final question, Aisha, is OLVI Health. Now, if you have to envision the future in the context of where GI is going and in the context of the future of GI, where do you see it land? And if you have to freely think, no boundaries, no limitations, 3 to 5 years from now, what's it going to be about? How will it change lives and how will it change you and your team?
Yeah, that's a wonderful question. I think in the next 3 to 5 years, we're going to see, emerging data, and we will finally be able to understand the impact of socioeconomics on women's health, for example. We will be able to understand what is happening with a woman's microbiome and how that's impacting disease. So definitely see an opportunity in the next 3 to 5 years to close some of those knowledge gaps that exist in the space. But I also see an opportunity that's limitless for OLVI, right? Because this digital technology, whatever the consumers are calling for and whatever is available from a technology standpoint, because we are one of the first to market platforms and we're nimble and agile and we have extremely great social listening, we can provide those services. We have the ability to build teams very quickly. We have the support of our colleagues in this initiative, and we have the opportunity to create a multidisciplinary platform as well. We're starting in the GI space, but GI is not operating in a silo. That's what we just talked about. We want to link women with and help them understand other factors, including what's happening with their reproductive system. And perhaps this is tied to their cardiovascular disease that they're experiencing. So I think the possibilities are endless for OLVI, and we have the ability to plug into whatever model is relevant at that time.
Excellent. Dr. Asma McCutchen, co-founder of OLVI Health. I'm so excited that we had this conversation, and it's very satisfying to see this shape up. Wish you and the team all the best, and we will be cheering you on.
Thank you so much, Praveen. Thanks for having me.